And welcome back to Daybreak. Jacob and Jared join us this morning as Health Monday, every second Monday of the month. And gentlemen, good morning to you.
Good morning.
Y'all are all fired up, ready to help a lot of folks beginning here on this Monday morning.
Fired up.
Marble City Pharmacy here in Sylacauga. Jacob and Jared Johnson, our guests, and talking about today COPD Awareness Month. First of all, Jared, what is this disease?
Well, COPD stands for chronic obstructive pulmonary disease, and it has to do with two different types of inflammatory lung disease. There's two components. One is chronic bronchitis. Some persons have that. That's where a person has a daily cough and mucus production. The other component is emphysema, not the mucus production, not necessarily daily cough, but difficulty breathing. And so this is something that affects a lot of people in the United States. As they get older, it gets worse, and the difficulty breathing ends up affecting almost everything they do from day to day.
Well, I guess, Jacob, y'all see a lot of folks come in suffering from that disease as well.
A huge number, and the causes that get us to that point are, aging is a factor, but other factors. Clearly, smoking, the primary factor. That includes secondhand smoke being a huge factor. That includes the places you work, asbestos, things like that, environmental chemicals, things you work in. All those things can lead to COPD, and we do have a very large number of patients that suffer from this disease.
You talked about one of the contributing factors being smoking and secondhand smoke as well. Do we see that getting better though?
Well, we do. We still have, in our older population, we still have people that lived at a time where smoking wasn't frowned upon. Mm-hmm. And so we have people suffering the consequences of this disease and other smoking-related diseases years and years and years later. My hope is that in the future, as we become more and more aware in the last few decades, that we have less of this disease going forward. But right now, in our older population, we have a lot.
What are some of the treatments for it?
Well, you use inhalers. Most of them are things you're going to breathe in. Not a lot of pills you're going to take. There are some, but mostly you're going to use different types of inhalers because it's a disease of inflammation in the airways, in your lungs, and in the passage through there. Most of the things you're going to use are things designed to decrease the swelling, to increase the amount of space that air can go through so that you can breathe in and out effectively.
This is a COPD Awareness Month, and we're talking with Jacob and Jared Johnson from Marble City Pharmacy here in Sylacauga. And of course, they sponsor Health Monday every second Monday of the month. COPD can really adversely affect your lifestyle as well.
Well, just think about it. If you have trouble breathing, if it's severe enough, people can have trouble just doing simple things such as walking, and they can't catch their breath because of it. And so our job is to make sure that persons understand what their medications do, understand the necessity of using their medications every day, and if a person is continuing to smoke, trying to help them towards stopping. One of the great things about stopping smoking is that no matter how far along you've gotten with smoking, if you stop, it increases your chances of being healthier later on.
People who have this disease, and Jared, Jacob, sometime, we're private people and we don't want a whole lot of folks knowing about our business. You got an actual area that you can really just sit down and listen to what they've got to say.
Oh, absolutely. We have a consultation room. If somebody wants to come in and talk about either, I have this disease, what can I do? What is it? What are the medicines? If they want to talk about, I have these risk factors for the disease, smoking, my job environment, what can I do to prevent it, even if they don't have it? Anything they want to talk about, absolutely, we're there for that, because I've had people tell me in that room before that quitting smoking is the hardest thing they've ever done. So I can sit in that room with you and understand and empathize. Yeah, I'm not asking you to do something easy, I know that, but I'm asking you to do something for you. So we do have a private area there that would help greatly.
And Jared, being sensitive to that customer's needs, and you work with these people a lot of times for years, and you recognize them when they come in, and sometimes you have to go that little extra mile to make sure they're comfortable for the day.
You do, and we want them to be. We want to be sensitive to where they are in their progression too. Not everybody's ready to quit smoking, so you can't just beat people over the head and get them to stop. So we work with them where they are to help them to be as healthy as they can possibly be.
Another topic this morning, and it has affected so many families, and it's one of the more sad diseases in its progression. This is National Alzheimer's Disease Awareness Month, and I've heard that name called 1,000 different ways as Alzheimer's, National Alzheimer's Disease Awareness Month. And you talk about gripping an individual, it seemingly strips you of every bit of dignity that you've built up down through the years.
Whose turn is it this morning? Is it mine? I can't remember. I wasn't listening when you talk. All right. It's heartbreaking to see when someone is diagnosed with Alzheimer's disease. You especially when you know them, or if it's your family member, you know what their current mental function is, and then the progression of that disease over the number of years that it lasts is, again, it's just heartbreaking to see. And you wish, for everything there was some form of cure for that, but there's not. We have medicines that help slow it down, and those work very well, but we can't stop it. And so it's tough to look at. It really is.
Jared, what is this disease? How do you describe it?
Well, first of all, just to be clear, Alzheimer's disease is a type of dementia. It is not the only type of dementia. And sometimes we throw around the term Alzheimer's, and that might not be what a person has. It is probably the most common form.
What's the difference in the two?
Well, there's multiple. There's not just two. There are many types of dementia. There's a type of dementia called frontotemporal dementia that we see sometimes, and there are others out there, but Alzheimer's would be the most common. As people get older, it's more commonly diagnosed, and as you might imagine, one of the first things we see is people forgetting things that have happened to them just recently. People not being able to organize their thoughts, put together a schedule, maybe even lay out their medications for their pill box for the week. Things that were once very simple for them that they can't accomplish.
Now, as we go on in life, Jacob, what ages are more vulnerable to see this in individuals?
Clearly, once you start aging, you love to say the term aging and let people at home wonder if they're aging or not. Wait, how old am I?
You're aging.
Yeah, I'm aging. Look at the gray hair.
Yeah.
No, once you hit, let's say 65, let's call it that, and start progressing from there, that's your prime time to see this. However, we see it significantly younger than that. It's called early onset Alzheimer's, and you'll get people 50, 55, 60 start seeing these symptoms. It's not as common, thank goodness, but it does happen. There's no magic age where you're completely safe from any form of dementia or Alzheimer's disease, really. I mean, it can set in, but it's much more rare until you hit 65 and above.
And Jared, we hear people say, they'll forget something. And they may be my age, and they'll say, it must be dementia. We really shouldn't take that lightly, because it affects not just only that person, but their families, and tremendous load on caregivers.
No, that's right. Well, first of all, we all forget things. I'm 39. We won't discuss your age on camera, but we
612.
Well, you mentioned 65 earlier, so I thought I'd clarify that.
That's right. We all forget things. That doesn't mean dementia at all. Sometimes we're overstressed. Our lives are packed with too many things. Our brain simply can't handle it all, and that's something totally different. Alzheimer's and other forms of dementia, like you said, are very serious, and I'm glad you touched on this, because I wanted to get to this. This can be and is a very significant burden on the caregivers. As a person progresses with Alzheimer's, sometimes they become feisty, even mean. They will sometimes lash out at people that they've loved for decades, the most special people in their life. And so not just the burden of taking care of them every day, making sure they get their medications, there's the stress of that, and then there's the stress of the personality changes and such that sometimes go along with it.
And Jared mentioned the medications. Are there a number of medications available today that maybe have improved from maybe a decade ago?
They have. We haven't had a new medication and a significantly different medication in several years now, but in the last, let's say 15 years, we have 3 drugs in one class and another drug in another class that we use now that can significantly delay the progression of the disease. Because here's the deal, if you have the disease, you don't cure it. It doesn't go away. It's going to progress. What you're trying to do is delay the progression. And to the point that, if you are diagnosed late enough in life and you can completely delay the progression, Alzheimer's disease won't be what destroys your life, your old age or something natural by that time, hopefully. You're trying to push it back just as far as possible. And the medications we have now have been very effective at that. And you don't gain back what you lose. And so starting early diagnosis, early catching, early treatment to delay is the key, because once you've progressed to a certain point, you're not going to move backwards on the scale.
Jared, what is the pharmacist's role here?
Well, the pharmacist's role, first of all, is to educate the patients on what they can expect, starting with the medications. What can you expect from this medication? Well, these medications, first of all, are going to take a long time to work. Second of all, as Jacob said, these medications will not cure the disease. We're simply trying to slow down the progression. And one of the most common questions I get is, my loved one, I'm not sure the medications are working. Should we just stop them? That's a fantastic question, because the disease is going to progress. And so you have to decide, how do you know if the medications are working or not? Unfortunately, the only way to know that the medications are working or not is to stop them, and then you find out afterward. But then you may have done something that's harmful to the patient. And so we kind of get in this gray area where it's confusing, because we feel like the medications may not be working. And sometimes the doctors will change to a new one. Try this therapy, mix it with this one. Hopefully it becomes a good combination.
Tell this story from time to time. I had a neighbor who had Alzheimer's, and he would revert back. He used to work at the quarry, and he would revert back to his quarry days. Couldn't tell me my name, but he could revert back. How does it work like that?
He could probably remember everything he did at the quarry and tell you technically how it was done, because that's so set in that long-term memory, and that's where they're reverting to a lot of times. How it works, your guess is as good as mine. Honestly, our knowledge of Alzheimer's disease is greater than it's ever been, but there is a long way to go. Science, we know what the basic causes are, what the chemicals are, what happens in your brain. But we have trouble saying, when we look at something, brain scan, well, was that the cause, or is that just something that happens with the disease? Well, there's a lot science doesn't know about Alzheimer's disease. And so while certain memories stay and certain ones go, we know it has more to do with long-term staying, short-term going. But beyond that, there's a lot of guesswork and a lot of variation from patient to patient that has it.
And speaking with your doctor, certainly very important. Maybe you've got a group of doctors that you're working with in this situation. But we talked about a few minutes ago the caregiver. Oftentimes, the caregiver becomes so burdened, and because they love, it may be a husband, it may be a wife, it may be a father or a mother, and they're not used to seeing their loved ones that way, and it's extremely difficult for them. How do they handle that?
Well, there's a great physical and emotional toll, as you mentioned. One of the things we want to do as pharmacists as well is be a source of support for the caregiver. It's one thing for us to give them good information about the disease and about the medications, but it's another thing for us to try to be there for them emotionally and to tell them about experiences in our family, because we've had them, and others, about what people have done to help them cope. And we want to help them get the right help, whether it's somebody to talk to, whether it's some relief and help just a few hours away to get themselves some rest. And so support for them is a major part of what we do as well.
We're talking with Jacob and Jared Johnson of Marble City Pharmacy on Health Monday, and we're in November, mid-November now, and we're in the fall season. Winter will arrive in December. What are some of the sicknesses we're seeing now?
Well, flu season is upon us. and it is very much upon us. It's not just flu season in name because it happens to be November. It's flu season in actuality because we are seeing it daily. Currently, we've seen more of it in children than adults. We're seeing a lot of sick kids right now. And then we've had a lot of your standard, cold and flu things for this time. You've had a lot of strep throat lately, a lot of that. And so, keep your hands clean, stay out of places you can stay out of if you're struggling, be as sanitary as possible in your life. But yeah, we're a lot of cold and flu right now, lots and lots.
Jared?
Yeah, sinus infections as well. I mean, it's all those upper respiratory things that you think about for sure.
And it's more difficult the older we get to bounce back from these type illnesses. And are we doing? Is the flu shot season over with, or is that still going on, or what?
Oh no, it's still going on. We'll give flu shots all the way through March or until the supply runs out. Flu season runs at times all the way up until April, and so if the shot takes 2 weeks to be effective, which it does, then you can consider it to be a viable option until very late in the season. But of course, it's better to do it now so that you'll be prepared for the worst. Historically speaking, January and February are the worst months for the flu.
Jacob, not only is Marble City Pharmacy a pharmacy, you offer a whole lot more. Talk about that in the last minute or so.
1 minute, boy, to cover everything we do, it takes 4 seconds. No, I'm just kidding.
Now,
of course, pharmacy, get your prescriptions. But as we've talked about, shots, immunizations, vaccines, we do all of that. We have a lot of home health type products, bandages, things of that sort that you're not going to find a lot of places for caregivers taking care of somebody at home. We have a lot of supplies like that. Your standard over-the-counter medications, of course, and I'm very proud to talk about something that has nothing to do with medicine at all. The front half or so of our retail store there is all gifts.
It's beautiful.
And Beth has done an incredible job with that. Come in and see it if you haven't. And she's got all the Christmas stuff out. We had open house last weekend, I guess. And so things are looking good. We've got a lot of Christmas stuff out, got a lot of Christmas specials. She's done a great job.
What about the compounding of medicine? Do y'all still do that?
Oh, absolutely. We do quite a bit of compounding. A lot of it centers around pain creams or female and male hormones, both topical and oral, and other routes of administration as well. We do a lot of that.
And not only do you do that, but you have the shoes. You have you're talking about a full pharmacy. They've got it at Marble City Pharmacy, and of course this is COP Awareness Month, National Alzheimer's Disease Awareness Month, and we talk with Jacob and Jared every second Monday of the month to talk about all these. And it is Thanksgiving, and guys, we got a lot to be thankful for, don't we?
Oh, we do. Tons.
All right. Thank you both for being with us this morning. Jacob and Jerry Johnson from Marble City Pharmacy. It is Health Monday here on this 14th day of November 2016. Much more ahead. National news, a look at sports. Alabama and Auburn on the gridiron this past weekend with differing results. All of that and more as Daybreak continues at the top of the hour. Don't go away.